Hi everyone, very good morning and welcome to this free live YouTube session. So I hope everyone's doing well. Before we begin, a quick confirmation in the live chat box if I am audible as well as visible, so we can begin without any delay. And till the time all our students join in, I'll just brief you what is coming up for the rest of the month as well as for the month of January, because a lot of students have written to me asking about the courses that they should refer to for both path and micro. So I thought I'll be able to brief you up better over a video session than over Telegram or Facebook. So all of you were a part of this YouTube series which is ending today, and we have finished these 5 sessions on YouTube where we discussed images, clinical questions, stains, flow cytometry, and today we'll be wrapping it up with the instrument part. But from today itself, we have a series of lectures which are starting on the Unacademy platform. So today itself at 5 o'clock, we have a very, very important session of practical pathology. And what are we going to study in this practical pathology? We are going to start with all the histopath slides. All the histo or the hematology slides that you get in your exam, all of those we are going to start with. So all of these are free classes. They are everyone can join in. It's everyone is most welcome. In fact, you should tell all the students in your college too, because this will help you get that extra edge in your practicals. Also, all the students who are targeting NEET PG 2021 or INI CET or the next year exams, any exam of next year, you know that now practicals have become very, very important. Slides, images, instruments, gross specimens, a lot of things are being asked. So all of those I'll be covering in these sessions. So we are starting today at 5 o'clock, and I hope to see all of you in class. Okay. Also, we have a series of 8 o'clock and 9 o'clock sessions of quizzes which are going on 8 p.m., 9 p.m. on Unacademy, which everyone can subscribe to. It is a free quiz, so you can always download the app and definitely you can go ahead with it. Okay, so many of you asked me about the full course pathology. So this is what the full course pathology is. Starting January 15th up till January 26th. Every day we have a total of 6 hours. So basically 12 days, 6 hours, a total of 72 hours of pathology, which will take care of any exam that you are targeting next year. So that is where full course with Robin's 10th edition updates, with your images, MCQs, everything will be taken care of, be it general path, systemic path, blood banking, hematology. Everything of pathology under one course, so that there's no confusion and you don't have different places to go to. So starting January 15th, we are going to start with it. So like I said, Jan 15th onwards is the batch where I'll be helping you with pathology. So this is what actually I wanted to brief all of you all about, so that if you want access to full course pathology, this is where you need to get it from. Okay, so we'll start with today's lecture, and giving you a reminder, after this class at 10 o'clock, we have another session today at 5 p.m. where we start with all the slides of pathology that are important from practical point of view. Coming to the quiz time. So today's instrument based session is going to be a quiz based session. Okay, and I'm going to put up a small question in front of you, and you have to identify the same for me. Okay, so let us begin without any delay. Let us start with question number 1. It's got a lot of GIFs also. So there's a technique that I've put up in front of you. You guys need to identify. Is it IHC, is it immunofluorescence, or is it FACS? So whatever you feel is the correct answer, let me know. I'll give you a 20-second timer which is up on the right. So you need to abide by that. And yes, the time is up as well. So what is the answer that everyone's got? So there are 3 techniques written in front of you, and I've got 1 or 2 answers. Yes. Okay, many of them coming up now. Correct. This is FACS. So who is going to tell me? So this is IHC. See, if I would have said IHC, it doesn't look like IHC. It is immunohistochemistry. That also I've got in one of the questions today. It could be immunofluorescence, but no, this is a machine, and you can see that the cells are flowing. You can see this GIF. So I've tried to include some GIFs today. Yes, this is FACS. So what is the full form of FACS? This is not IHC, not immunofluorescence. This is FACS, fluorescence activated cell sorting. Okay, correct. This is actually nothing but a flow cytometer. Why did I start with this? Because recently we discussed flow cytometry. I just wanted to tell you the other name. It's also known as FACS, because if you decode the name fluorescence, because you can very well see that I've added different fluorescent dyes. I've added a red color, I've added a yellow color, I've added a green color, I've got a blue color. So different fluorescence. And on the basis of those different colors, I am sorting the cells. I've got 4 chambers. Cells are getting sorted by their different properties. So if we just look at the static picture once, if you remember, this is where the sample was inserted. Once the sample has been inserted, it's going to go through this chamber, and depending on different properties, see, maybe some of them have CD markers, like they have CD5, CD19, so they'll get sorted into different chambers. That is why, what do I call it? Fluorescence activated cell sorting. So remember, FACS, if written, is nothing but a part of flow cytometry, right? This is done. Let's go to the next one. Okay, so here you need to identify this particular instrument for me, whatever is going on in this particular short video. What is this instrument, guys? Is it a platelet agitator? Is it a biomixer? Is it a blood bag storage technique, or is it a centrifugation? So I see there's a blood donation going on, and I see a machine which is rocking from left to right. So what exactly is that? Okay, so most of you call it either B or D. So basically, confusion between a biomixer and a blood bag storage. No, blood bag storage would be in some kind of a refrigerator. Okay, what is this? This is not a blood bag storage. This is a biomixer. The word only tells you it's mixing the blood. Let me show you a picture, then we'll come back to this video. So this is a biomixer. Look at this. Now this is the static picture. I'll give you all the parts. So when you go to donate blood, when we go for blood donation, I'm sure many of us must have donated blood. So when we go for blood donation, guys, this is the machine. So while you're donating blood, the phlebotomist keeps your blood bag on this machine. And this machine is going to rock left and right. Why? Because as your blood is entering, it needs to be mixed with the anticoagulant so that the blood does not clot. So in order to ensure proper mixing, you use what? You use a biomixer, right? So biomixer, because the blood and the anticoagulant will very nicely mix with each other, blood will not clot. But that's not the only advantage. Do you see over here you've got a display screen? So you know, from beforehand I've set a target in this machine that whether I have to collect 350 ml of blood or I have to collect 450 ml of blood. So depending on what bag I'm using, all of you know we have 2 types of bags. Either we can collect 350 ml or 450 ml depending on the weight of the patient. Okay, so beforehand I have already given instructions, set it in the machine. So as soon as, say, I have set the target to be 350, as soon as it will be 350, the weight over here, the collection will be 350. This is going to stop the collection. How? Automatic, auto cutoff. How will it stop? Because do you see I've put the tube through a clamp over here. This is a clamp that is present in this machine. So as soon as it touches 350, this is going to shut off the collection. This is going to auto clamp the tube. Will more blood come from the donor? No, more blood will not be collected. So it's actually maintaining safety also. You don't have to constantly stand on the donor's head. When you've got a big setup, I think this is such a useful thing, because as soon as it will touch 350, it will shut off the blood collection. Auto clamp. Similarly, if you want, you can set it to 450. So as soon as it will touch 450, auto shut off. Also, it will tell you the flow rate. That is, you know, how is the flow from the donor? Is the blood being collected at a good flow rate, or has the vein collapsed, or is the blood not being collected now? All those are going to get sorted. So this machine is just not a biomixer. It tells you so many other things, right? Okay, very good. Many of you, I was going to ask you this and already you've told me. At what weight do we collect 350 ml of blood, and at what weight do we collect 450 ml of blood from the donor? So remember, to collect a minimum of 350, person should be more than 45 kg weight. That is the weight criteria for blood donation. However, for collecting 450 ml, person should be more than 55 kg weight. So remember, more than 45 kg is the cutoff, provided you are collecting 350 ml only. And 450 ml collect करने के लिए you cannot collect it from a 45 50 52 kg person has to be above 55 kg. Perfectly told by all of you. Great. Let's go to the next one. So one before that, this biomixer has many properties. Now why just a blood bag? Whenever you've got any, say, EDTA vial, what do? We collect blood and we shake it manually. But when you've got thousands of sample, manually doing that is so difficult. So the same biomixer, you are going to keep all your samples on top of it, and the biomixer is going to rock left and right and shake all your samples. All your anticoagulants are also mixed. So the same biomixer that I'm using in a blood bag, I can use that for the samples also. It's the same thing, right? Okay, let's go on to the next one. You need to identify this instrument and this GIF. Histopath processor, rotary microtome, sample sorter, or a cryostat. 10 seconds more to go. So we've got a pathologist and there is a block and she is kind of cutting it. So what is this? Okay, again a difference. B and D में problem आ रही है. See, this is, guys, this is a rotary microtome. First and foremost, let's dissect it. See, microtome means cutting machine. You can see I've got a white color paraffin block over here. Let me use a laser pointer and show you. I've got a white color paraffin block over here. And do you see how the pathologist or the technician is rotating the blades? Can you see on the side? She is rotating it. Okay, as she is rotating, that's why I'm calling it a rotary. And microtome, because as she'll rotate it, the block will get cut. The paraffin block will get cut and the section is being cut. So see how many sections she's got on the bottom. She'll take this up on a slide and she'll look at it under the microscope after staining. So rotary microtome. Many of you called it a cryostat. Same thing is there inside a cryostat also, but what did I need for a cryostat, guys? For cryo, I needed a temperature of, say, a -25, a -30. If you remember, a few days back, I showed you this particular cryostat machine in one of the sessions. So in that, will the rotary microtome be present out there in the open? No, it will be present inside a machine because I need minus temperatures, cryo temperatures, right? Okay, so this was a rotary microtome. How will you identify it? Either you can get a picture or a GIF. By the rotating movement and the cutting action, you'll easily be able to get it. Okay, coming to the next one. You need to identify the techniques. Let me know what is A, what is B, and what is C. A, B, and C is what you need to tell me. Let me give you a hint. This is something to do with pap smears. But you need to tell me the differences in these pap smears that I've got for you. So A, B, and C, what are the techniques? Time's up, but I've not got any answers as yet. One answer I've got from Dr. Vikas, which is great. So you need to label and tell me, guys, what is A, what is B, and what is C? They are all three ways of doing a pap staining, but now they are very advanced methods. What is it? So what is A if I ask you? A is something that your gynecology faculty must have shown you so many times because that is the conventional method of doing a pap smear. So what is A? A is referred to as a conventional pap smear. Old school. This is what we've been doing since ages. This is a conventional pap smear. Okay. What is B? You see, now instead of, dirty material all over, they've focused it on a circle. Over here also, and a big circle over here. So when the circle is small, the technique is known as sure path. Sure path technique. It's a machine, okay? It's a machine, sure path. And when the circle is big, you call it thin prep. So there's a very small mnemonic I've told you guys. Sure path will have a small circle, S for S. Sure path will have a small circle. Thin prep, like a thin layer, will be bigger, will be spread out bigger like a smear, okay? So sure path, small circle, thin prep, big circle. Let me show you one more technique. Let me show you again something more. Look at this. Now do you see, if you want to see the differences, here you see a very, very small circle, roughly of 13 mm. That's a sure path. Here you see a big circle of 20 mm and that's a thin prep. So remember, sure path versus thin prep. Which is the smaller circle? The smaller circle is sure path, only of 13 mm. Which is the bigger circle, 20 mm, that is going to be thin prep. So this is how you prepare all your pap smears, guys. Nowadays, many of the institutes, they just don't practice conventional pap smear. They also practice sure path or thin prep. That is what is there depending on what machine they've got. One of the two they are going to practice. Are we okay with this? Can I in one diagram tell you? So all of these are for pap smears. All of these can be for pap smears. In one slide, should I tell you the basic difference between a sure path and a thin prep? If you have two machines in front of you, how do you pick up which is a sure path pap smear machine, which is a thin prep pap smear machine? Another image based question for your Central Institute exams. Okay, so first and foremost, do you guys remember this? The old school, what was this that you were using for a pap smear? What was this that you were using for a pap smear? Only this one that I have highlighted out here. All of you know that we have studied this. You have studied this in gynecology also. This is the Ayers spatula, है ना? All of you remember, this is the Ayers spatula which you use for, very good. So all of you know this, great. This is the Ayers spatula. So I take the Ayers spatula and what is this next stick next to it? What is this brush-like thing? This is the endocervical brush. This is the endocervical brush. I'm sure in gynecology you guys have studied it in much more detail. So I've got an Ayers spatula. I've got an endocervical, many of you calling it cyto brush. Okay. But now I've got some advanced techniques like sure path. What do I do in sure path? Do you see there's a vial, there's a container? So let me give you a quick recap. With this Ayers spatula and cyto brush, when you were using these two, this Ayers spatula and cyto brush, you know what you do? You take the sample from the patient and on the slide you wipe it, like you're painting. So that is why what kind of a smear do you get? You get this kind of a smear. Because you take the brush and you paint the slide like this. Now imagine how much time would I be wasting. I have to look at that entire slide from start to end, edge to edge. I have to look at that slide. So then they thought that let's save up on time, and if I put the sample only in this much area, the pathologist and the processing and the time saving will be so much. So then they thought, let us come with new techniques, and the new technique is sure path and thin prep. So in that they use this. Can you see this brush out here? These two brushes that I've got. So with this they take the sample. This is also a cyto brush. This is also a cyto brush, but it's a little advanced. Okay, with this they'll take the sample. Now they are not putting it on the slide. Now they will put it in the container. Can you see? I've put the brush in the container, and you know what? What will you do? Two things. Either you can rinse it in the container. So jitne bhi cells honge, whatever cells are in the brush, they will fall in the container. But do you tell me a yes or no? Do you agree no matter how much I rinse it, some cells will still be stuck on the brush? Some cells will still be stuck on the brush. Yes. Do I want to waste material that I've got from the patient? Do I want to waste it? I don't. So what do? I can cut off a little bit of this brush and drop it in the box. In this container, I'm going to drop it. So whatever little cells that I was planning to waste, those are also not wasted. So I break, this brush is detachable. So from the end, from the anterior end, this area, the brush is going to be broken. I'll break it and I'll throw it in the container so that all the material is also there. That is what we do in a sure path. So you'll ask me that, ma'am, what's the difference between a sure path and a thin prep? Look at this, guys. In sure path, can you see that container? Can you see that tiny brush which I have thrown inside it? Yes. So whatever little cells I had to have, I've thrown inside it. What do I do then? I take the sample from here. I put it onto a slide. So can you see? I've put it onto a slide in a round small area. How many mm? Who will tell me? Quick revision. I've taken the sample from it and I've put it on a small area. So how many mm circle will I make? A small one. 13 mm circle I've made. So here you can see a tiny, in this very circular small area, a 13 mm location I have put the cells into. Okay. Versus what do you do in a thin prep? In a thin prep, it's a little different. In thin prep, I don't break the brush and all that. No. In thin prep, whatever sample I've got, see, I've got sample over here. You can see some cells inside. Okay. So what do? I take a particular rotatory knob. Can you see I'm spinning it? I'll collect the samples on this filter. So I'm spinning something on top, so the cells will stick on the filter. Over here, which I'm highlighting, over here the cells will stick, and then these cells I'm going to put it on a slide. So basically by a filter I'm catching the cells and I'm putting them on a slide. So have you learned the basic difference? In SurePath, I've put that brush inside. I'm going to take it from a syringe and put it on a slide. I don't do that. Machines. Now we've got very advanced machines. Machines do all of this, okay? In thin prep, I'm going to do a rotatory movement, get the cells stuck on a filter, and with that filter, I'll transfer it onto a slide. Now, what kind of an circle do I get in thin prep? In thin prep, I'm going to get a 20 circle. I hope the basic difference is clear between the three things: conventional, SurePath, thin prep. That's a typical next year INI CET or a NEET PG question that I expect, because now SurePath and thin prep are the, you can say, the most hyped up things in the field of pathology. Okay, so coming to the next one, a simple one. Quick 20 seconds, identify this instrument for me. What is this? So you've got a pathologist who's got this box, and it looks like as if these are piano keys, and the pathologist is going to play it, and that is what actually we do. This is a blood cell counter. This is a manual counter. It's not a machine. So you know what, can you see some markings over here? So on my own, I have decided this will be for neutrophil, this is lymphocyte, this is monocyte, this is eosinophil, these are basophils. These 5 keys are neutro, lympho, mono, eo, baso. Now when I'm looking at a slide, I can't keep writing down, okay, I saw one neutro, then I saw one lympho, then I saw one mono. No, we don't have so much time. I have to count, say, 100 cells. Total, I have to count 100 cells. What do? So this is something we get by practice. As we are looking at a slide, I have one hand of mine on this cell counter, and whatever cell I'll keep seeing, see I'm seeing a neutrophil, I'll press this first button. I see a lymphocyte next, I press the second button. Then I see 3 neutrophils, I press this button thrice. So basically, as soon as the total of this will become 100, this counter is very smart. As soon as the total will become 100, so maybe in that 100, I pressed neutrophil button 60 times. I pressed lymphocyte button 20 times. Similarly, I pressed the monocyte button 10 times, eosinophils 10 times. So as soon as the total become 100, there's a bell that goes off in this. And I know that, okay, 100 cells I have counted, 100 cell count has been complete. And it will show me that, okay, neutro you clicked 60 times, lympho you clicked 30 times, so on and so forth. So please remember, manual cell counter. Manual cell counter. Are we okay with this? Coming to the next one. Identify the needle. Identify the needle in front of you. So there's a bone marrow biopsy needle, Salha's needle, Klima's needle, or the Wim Silverman needle. So these 3 are the same parts, are the parts of a same needle, guys. They are parts of a same needle. Okay, so I've got a couple of different answers. You're probably not looking at the needle too well. Yes, if I zoom into the needle for you guys, this is a Wim Silverman needle. First and foremost, Salah's and Klima's needle that all of you said, that is something we use for bone marrow aspiration. For bone marrow biopsy, we use the Jamshidi needle. This is none of them. I'll zoom into this picture. Did you see? So you've got a cannula. Typical, like every needle, we have a trocar and cannula, but this one has an additional thing. Can you see the bifid nature of this needle? So remember the needle which is V. Obviously, we'll be studying more on this when we go into our practical sessions starting today. When we come to the instrument part, I'll teach you all the slides, all the needles. But remember the needle which looks like a V or it looks like a bifid, that is the Wim Silverman needle. Wim Silverman needle. Yes, I hope all of you remember this. Perfect. So the needle that looks like a V from the front. Wim Silverman needle, and that is what we use for a liver biopsy. That is what we use for a Liver biopsy. So it's a liver biopsy needle, guys. Please remember Vim Silverman needle V, bifid one from the front, that is used for a liver biopsy. Moving on, let's go to the next one. So I've got you 3 vacutainers out of here, purple, green and yellow. You have to tell me which is the correct match in terms of the test and the vial. So I've not given you a timer on this because this might take a little time to read all. So you can let me know. Yes. Okay, so I've got a couple of answers. Right, so first let me ask you the basic. What is a purple color vial? The lavender blue or the purple color vial, everyone knows it's the EDTA vial. Everyone knows it's the EDTA vial. So whenever I want to do a hemogram, complete blood count or a hemogram, this is what we use, right? Next, coming to the yellow vial. Does the yellow vial have any anticoagulant? No, it doesn't have any anticoagulant. It in fact is done, it has a clot activator. It has a clot activator gel. That gel is going to help you form the clot when you want the clot to form. Yellow. What is the green vial? The green vial has it written also. We've used heparin in it. We've got heparin in it. So now what are the tests that we do for each? So please remember, the purple is EDTA, yellow is clot activator, green is heparin. Remember, whenever you want to do the hemogram, you are going to go for the purple vial. For osmotic fragility, which is, many of you must have read it, that in osmotic fragility, we do it for hereditary spherocytosis. Now it is no longer done. It is more or less an obsolete technique. But when osmotic fragility was being performed, then heparin collection of blood was happening. And yellow vial, where you want the clot to happen, so all your hormone studies, because in the hormone studies, are you interested in whole blood or are you interested in the serum? You are interested in serum. So you, like, if you want to do T3, T4 thyroid hormone testing or TSH or maybe a prolactin or any other hormone that you are interested in. So you are interested in the serum. So in that case, you're going to use the yellow vial. Let's look at the next one. Other options. Purple for TSH? No. Purple I use for hemogram because whole blood. Yellow for peripheral smear? No. For peripheral smear, I'll use EDTA because whole blood, opposite they put it up. Green color for cross matching? Not at all. What is the vial that we use for cross matching, guys? For cross matching, we have a separate color, a pretty baby pink color vial that we have for cross matching. So all of these were incorrect options. Option number D was fitting perfectly well. Coming to the next one. You have to identify the kind of microscopy that is shown in this GIF. Yes, let me know. So you have some mercury lamp and you can see from that mercury lamp you are getting some light, something getting excited over here from the filter, hitting a dichroic mirror, getting reflected to some sample of yours. Some other light from that sample is going back and to the eyepiece. I think the dichroic mirror pretty much gives you the answer over here. Yes, this is a fluorescent microscope. So what happens in a fluorescent microscope? This is what happens in a fluorescent microscope. First and foremost, you have a light source. Okay, you have a light source over here, which is usually a mercury lamp. Okay, mercury lamp. Okay, from there you've got some rays that will be sent, which will be excited by a filter. Okay, so the rays have been excited. They hit a mirror which is at an angle. What is that mirror? Dichroic mirror. That mirror is going to reflect them to the sample. This is your specimen. It could be some sputum sample, it could be some tissue sample. So this has put it up to your specimen. Do you see the specimen is green in color? Why? Because I've added some fluorescent dye to it. This is a fluorescent microscope, so I've added a fluorescent dye to it. So what kind of a dye will I add to, say, a TB sample? If I'm suspecting tuberculosis, what kind of dye do you think is the fluorescent dye that I use for tuberculosis? All of you know it is auramine rhodamine. All of you know it is auramine rhodamine. So some kind of dye I have added over here. So this is going to hit the specimen. After hitting the specimen, the light is going to be projected back. So you can see the light is projected back, passes through the dichroic mirror and comes to the detector. So let's see this again. First you have a light, go via the excitation filter, it goes and hits your specimen. The specimen reflects the light back and that goes and comes to your eyes, and that is why you see that fluorescence, and that is the GIF that I was showing you. So this was a fluorescence, my fluorescent microscope, in which you have to remember that the light that I was emitting was a shorter wavelength, and after it has come back from the specimen, it is a longer wavelength. So see, the light that you were sending was of a shorter wavelength. When it went and hit the specimen, that specimen has fluorescent dye, it is converted into a longer wavelength. So that's a previous year question. Shorter wavelength converted into longer wavelength. Shorter wavelength of light converted into longer wavelength. And what is the most common fluorophore that you use? The most common fluorophore that you use is FITC. Even in flow cytometry, you were using fluorophores, that shiny things, the fluorescent things. So remember, fluorescein isothiocyanate. Fluorescein isothiocyanate is what you use as the most common fluorophore. Are we okay with this, everyone? So I hope you got that GIF. The next one, many of you might know and might not, but it's something that you'll definitely learn. Okay, so I'm not asking you this because I want to teach you this. If you say that, ma'am, I'm working in a center where I don't have a fluorescent microscope, but I want to do fluorescence microscopy for some diagnosis. I want to do some fluorescence microscopy, right? So what would I tell you? There's one way. You see, this is a normal microscope. It's a normal microscope. Can I convert it into a fluorescent microscope? Yes. There's a fitting called as para lens. Para means on the side. Lens means just attach it on the side of your lens. Do you see on your lens on the side you have attached a para lens? This is a para lens. You've attached it. This para lens is a very good way that if you have a normal microscope, you want to convert it into a fluorescent microscope. What are the things that you need? You'll say, ma'am, I need a filter and I need a different kind of a light. I need a filter and I need a light. So this particular small device, it's like a small fitting that you put. This has a special filter inside it. This has a light inside it, which will convert any normal microscope. Any light microscope can be converted into a fluorescent microscope. So remember this fitting. This fitting is a para lens. This fitting is a para lens. Okay. I hope you've learned something. This was not for your quiz. This was just to teach you how else can this question come. So a regular fluorescent microscope you know, but how the conversion can be made, it's by a para lens. Okay. A quick question for all the second year students. What is this jar? Quickly identify this jar for me. Let me know the name of it. Nothing much to teach you in this. It's a spotter image, guys. Meanwhile, Dr. Subhesh, thank you for sharing your result with us. A lot of congratulations to you and your family on the result. And definitely time to take a small break and enjoy your success. Wishing you all the very best for your future. Coming back. So yes, what about this particular jar? Perfect. It's not necessarily for pap smear. It can be used for anything. Maybe FNSE slides are put in it. Maybe pap smear slides are put in it. Anything can be put in it. It's a Coplin jar. I just wanted you. It's basically, so I've got you. This is the jar, how it looks like. Some institutes have a glass jar. Some have plastic jar. That varies. So this is the jar. There's a lid on top of it. And that's the top view. So can you see? There are slots to keep the slides. Slides will fit perfectly. They won't stick to each other. So I can fit multiple slides. Multiple slides I can fit in one Coplin jar and they were not going to stick to each other. So I just wanted to show you this once. It's a Coplin jar. I hope you got that. Okay, coming to this one. Identify the test. CBC, ESR or hormone studies. I think the machine also has a writing on it. So if you're not good with the theory, you should be good with copying, and that is written on the machine as well. This is a black color vacutainer. This is a black color vacutainer which we use for automated ESR, automated analyzer, erythrocyte sedimentation rate. So do you see, it's a very thin vacutainer. It's not like the other vacutainers, it's very thin. I've got a full box for you. It's a very thin vacutainer because exactly this vacutainer will go as it is inside the machine. You don't have to take the sample out of this and prepare it in some other tube or something. No. Like normally guys, what are the tubes we use for ESR? The manual methods which we do ourselves manually. What are the two tubes that we use for ESR estimation? There's a short tube and a long tube. I hope everyone remembers there is a Wintrobe's tube and there is a Westergren's tube. है ना? There is a Wintrobe's tube and there is a Westergren's tube. Correct? So that is when we are doing it manually. We take blood, we put it in the tube, then we wait, and the full process. That is manually. Here I'm not doing anything of that sort. I'm collecting the blood in this vial, directly putting this vial into the machine. Automated. So the black color thin vacutainer is something that you do when you want to test ESR by the automated analyzer, the auto ESR analyzer, right? Black vacutainer. Talking about ESR, maybe you can tell me something about this tube. What is this tube and what are the uses? The last two questions for the day. What is this tube and what are the uses? Is it for hematocrit, PCV, ESR or all of the above? Hematocrit, PCV, ESR or all of the above? So one answer I've got as A, that is hematocrit. And most of you say all of the above. Correct. So first and foremost, hematocrit and packed cell volume is the same thing. Hematocrit is also known as packed cell volume. Third option is erythrocyte sedimentation rate. Answer is all of the above. What is this small tube? This small tube which has a labeling from 0 to 10. This small tube which has a labeling from 0 to 10. This is the Wintrobe's tube. This is the Wintrobe's tube. Okay, so do you know at the first go, how do you differentiate between Wintrobe's and Westergren? Wintrobe is the small name, so Wintrobe tube is small. Westergren is the bigger name, longer name, so Westergren pipette is longer. So remember, Wintrobe, small name, small tube. Westergren, big name, big pipette. So remember, that was the Wintrobe tube, small tube. This is the Westergren pipette, which is the large pipette. What is the use of Wintrobe's over here? Was all of the above. Guys, it is used for PCV and ESR. Common sense. See, I collected blood in this tube, and many a times we spin it, we centrifuge it, or we can just let it settle on its own. You leave it for 1 hour. You leave it for 1 hour in the lab and you forget about it. After 1 hour, obviously all the heavy cells will settle at the bottom. All the red blood cells will get packed at the bottom. Packed at the bottom. That is known as packed cell volume. All the red blood cells will get packed at the bottom. That is packed cell volume. And can you imagine, from here, the RBCs have fallen up till here. Earlier, you had taken the sample up till the brim. Now the RBCs have settled. So how much have they fallen? How much have they fallen tells you the erythrocyte sedimentation rate. So the same tube has two functions. What is packed at the bottom is your packed cell volume. How much have the cells sedimented? How much have the cells fallen? It is erythrocyte sedimentation rate. So the same tube helped you know two things. Yes? Okay with everyone? Correct? Now please note the last question for the day, which is the winner question. What is this technique? It's something related to what I just taught you, something related to that. So what is this particular technique? I've got this person who's holding a very small capillary tube. He's filled it with blood and he's put it on this card kind of a thing. And what is he trying to figure out? What is he trying to do? Yes, the winner question for the day. Winner question for the day. I had also given you this homework last evening on Telegram and I told you that I'll be asking you today. So what is the winner question? Who gets it right? Who tried to search and read about it? It's the same thing that we just studied. Instead of doing it in a big tube that is the Wintrobe's tube, can I do this in a small capillary that is microhematocrit? Because maybe I want to test it for a pediatric patient. Maybe I don't have, I have an ICU patient, the blood sample, I didn't get, good amount of blood sample. I could only do it from a finger prick. So I do a finger prick, I fill up this tube because it's a very thin tube. And then do you see, I've made it stand on this sealer. It's a sealer. One end of it will be sealed. As soon as you place it in this, it's written also Crito seal. That must be the company. So it's a seal. One end of it will be sealed at the bottom. Yes, it's a sealant. Very good. And then you can easily see how much has the tube fallen, how much have the cells fallen. Same thing at the end. Look at this. This was a minor capillary tube, a very thin capillary tube. And in this, by putting it on that seal, I'm seeing the same thing. How much have the cells settled? That is packed cell volume. But I'm doing this in a very small quantity of blood. I'm doing this in a very small capillary tube. So I'm not going to call it hematocrit or Wintrobes. I'll call it microhematocrit. So this is something very commonly done bedside. Even the residents can do this, because all that they need to do is take a finger prick, fill the capillary tube, put it on a sealant and read it after 1 hour. And obviously the readings are different. You've got different scales to read how much has it fallen. All of that is calculations, which is not required at this point. But yes, a small capillary tube. Many of you said same capillary tube, guys, it is used for BT-CT estimation. You are right. For clotting time estimation, yes, we use capillary tube. One more use of this capillary tube. If I line this capillary tube with acridine orange and I centrifuge it, what test am I trying to do? The same capillary tube, I line it with acridine orange and I am trying to look for some organism, I'm trying to look for some technique. Everyone's heard of QBC, quantitative Buffy coat, that we do for malaria. Yes, so the difference is, inside, those are special tubes. Inside those tubes, they will have a lining of acridine orange, because acridine orange is a fluorescent stain for malaria. So yes, that will also use this tube. So this tube can be used for microhematocrit analysis, it can be used for clotting time, it can be used for QBC in malaria. So this capillary tube has a major advantage. It helps you in taking less quantity of blood and analyzing so many things, right? Okay, so that was definitely not the last. This is the last animation that I have to show you for today, and I hope everyone gets it, and then we'll call it a class. Okay, so everyone be alert. I'm going to show you an animation of 10 seconds and you need to pick up the technique that I'm showing you. Okay, so the animation goes this way. I've got an antigen, okay, after which I've got some primary antibody, I've got some secondary antibody, and I've got AEC. So I've got a primary antigen, I've got a primary antibody, secondary antibody, AEC or DAB. AEC or DAB is what I've got. So what technique is this? I think everyone knows this. Very good. So just by looking at antigen antibody, many of you said ELISA, which is fine. But if I would have been showing you ELISA, I would have shown you some ELISA plate. I would have shown you a well or an ELISA plate. I didn't do that because this is being performed on a slide. Same concept. You've got a primary antibody. You've got a secondary antibody linked to an enzyme, and then you add a chromogen. Now that chromogen is the color giving thing. If I use AEC, I'll get a red color. If I use AEC, I'll get a red color. If I use DAB, I'll get a brown color. Simple. So that is how I've drawn it. If I use AEC chromogen, I'll get a red color on immunohistochemistry. If I use DAB, I'll get a brown color on immunohistochemistry. So yes, guys, this was a case of immunohistochemistry, just a small procedure of how they can give it to you in the exam. I know all of you are experts. If you know DAB, diaminobenzidine, you guys already know it, that this is a case of immunohistochemistry. I think we've discussed it so many times, right? Okay, so yes, that was definitely the slide, and that finishes off our session for us. Just giving you a brief. I hope you learned something new from this session. Just giving you a brief that we are meeting again today at 5 o'clock because we've got a session lined up at 5 where we are going to start with the practical part. Today I'll be starting with all the slides. You know, slides are important not only for practicals, and we are going to keep it in a very concise manner. I am going to divide all the slides system wise. We are only talking about slides which are, which will help you build up your basics very, very well, which will help you attend your practicals very well. And for the NEET students, I think there is nothing better than this class, because this builds up on your practical. Something as simple as fat, or something as simple as colloid goiter or papillary carcinoma thyroid. All those basic slides which you miss out while you're reading very advanced things. We are starting with that today. Tomorrow we are going to go on to the gross specimens, and day after we'll be talking about instrument tray and RBC, WBC pipettes, the diluting fluids. That is how I divided it. Slides, then gross, and then instruments. Okay. So one question. No, Dr. Goyal, immunochromatography, unfortunately, I don't have that image right now. But in immunochromatography, I can probably show you in the coming sessions. Like you must have seen, let me give you an example. In immunochromatography, ICT is a principle that we use for the card test. If you've seen my previous sessions on the malaria card test or HBsAg card test, immunochromatography is something we do on that. But yes, the underlying principle of having an antigen and an antibody and substrate, that somewhere remains the same. The technique obviously changes. Because that is something we are doing on a card that is different, right? I'm sure you've been a part of the sessions where we were discussing malaria card test analysis, and I told you about immunochromatography, right? Okay. Thank you so much, guys, for joining in. See you at 5 o'clock. Keep studying till then, and hopefully we'll have a good session at